for everybody who's now continually watching, welcome back. But I have a new guest today. Somebody who's really interesting to me because this is somebody I actually grew up with. We went to high school together. And before we get started, I want him to introduce himself and kind of tell my audience why you think I'm interested in you and your story and kind of like how you got into what is regenerative medicine. So
Yeah, Lawrence Bourgeois, Dr. Lawrence Bourgeois. We, we've known each other forever, man.
yes.
So, grew up together, played sports together, did really everything, right?
Yep.
And then somehow we end up in Miami, right? I think why you're interested too in having me on and why I'm interested as well is because longevity, right? That's what we're going to talk about. Longevity, anti-aging. I mean, that's the hottest thing in the world right now.
Exactly.
Regenerative medicine, people want to fix things, not cover them up, and they want to keep going up as opposed to going down as they get older, right?
Exactly.
So,
okay. That's a good way to intro because honestly, that's the cleanest one we've gotten thus far.
Oh,
Usually
man.
it turns into like
There you
this
go.
rant, but that was crisp. I like that. All right. So let's go to the beginning. All right. How did you find yourself in this field? Like, take me to the beginning days of saying, hey.
Okay. Yeah. Day one. All right. So first off, I was playing baseball in college, of course, right? As you know, hurt my arm. Couldn't really do much with it. I remember I hurt my arm. It was like I could lift my arm to about right here. Start shaking. It was a supraspinatus, infraspinatus tear. Really messed up. I was done with ball at that point, right? I could use my arm and I could go up this way with my bicep, but man, I couldn't really do much. So at that point, then, I went to every doctor. I went all the names that are the best for shoulders in the country, the guys you see on ESPN, right?
Yeah.
And they said, yep, shoulder surgery, right? Like, man, I don't, at the time I'm 21, right? Like, look, I don't want to get a surgery. I knew enough then that if I get a surgery now, when I'm 50, man, they're going to want to do a replacement or something because it's going to cause problems. I knew enough about it, right?
Yeah.
Because, of course, did some homework. So then I found this thing, stem cell. I didn't know anything about it, but I looked at it, did some homework, just checked it out. And I was like, man, this could work. Let me try it. It's worth that other than trying to get a surgery.
True.
So I went and got stem cell injections at a location and, again, didn't know it too much. Man, within weeks, I was moving my arm fully up like this, like I am now.
You're right.
I mean, it was like, man, so my biggest thing was, why was this not brought to me? Why wasn't it even given to me as an option? Like, hey, you need surgery, but maybe you could try this. Because I'm talking to the best guys in the country.
Right.
So it's like, well, why did they not offer it? I basically found it myself and then essentially fixed it. Yeah. Now I can't throw a ball 95 anymore, right? But I can use my arm. It's no problem. I don't have trouble sleeping. Completely normal, right?
Right.
So that's where it initially starts. And then I went to school, continued school to get the doctorate, right? And then at that point, came out and actually, that was always in the back of my mind.
Right.
First year or two was actually, doing some pain management, which is like the opposite, right? Unfortunately. We were working the pain management field. Really, everybody that you see, same thing. They come in with low back pain, knee pain, hip pain, doesn't matter. They get steroid injections. They get, nerve ablations. They get pain meds, maybe try some physical therapy. And next thing you know, referral for surgery. Then they come back after surgery a few months later and say, hey, I need some more pain meds. So then you see that cycle enough, you're like, man, this is not fixing anything. This is just accentuating the problem, making it worse.
True.
So then I said, okay, let me get back to the roots, back to what I really wanted, right? So went back into stem cells, learned the ropes on that, progressed. We built protocols. So, I mean, it's been like 7 years we've been doing our stem cell clinics, and almost 8, and we just built out really, really nice protocols that work, right? So it's been a blessing, but that's really what initiated and started it all.
Yeah. Okay, so it actually starts from a place where you saw that it was working. This isn't something you were like, no, I'm going to sell a skin. It was like, no, this worked for me.
100%.
I want more people to know about that.
100%. It actually was unbelievable. Now I see it every day.
Yeah.
So it's like the unbelievable, I guess it's more believable. But because you see it so much, right? The people who did everything, nothing worked. They're on their last. You're their last hope. They're going to get surgery, or they can't even get surgery because their doctor said, hey, you're not healthy enough for whatever reason, right? So we see those people all the time.
Let's talk about the term regenerative medicine, because this is your field, right?
Yeah.
And I'm gonna throw you right into the heat, okay?
Let's go.
How do you define regenerative medicine in your mind, like from a doctor's perspective?
Healing the body naturally without medication or surgery, working with what the body has to actually help fix it, as opposed to covering up and eventually making things worse, right?
Right.
Really, the body has a great ability to heal. It just needs help, right? Sometimes your body just needs help. So, if you give the body what it needs, whatever it is, whether it's a peptide, whether it's a stem cell, whether it's an exosome or something else, right? If you give it what it needs, it will do everything it can to fix the problem. And that's what regenerative medicine is, regenerating the issue.
I like that.
Yeah.
Okay. I like that a lot. All right. Let's go into it though. Let's go into the top three that what I picked up from you, right?
Yeah.
Stem cells, okay, exosomes, and peptides.
Yes.
Right?
Where
And
do we begin?
let's start with stem cells. Let's go into it because this seems to be right now from your perspective. This is the one that you are really passionate about. Let's go into what is stem cells in your mind?
Okay, so what stem cells are?
Yeah.
They're essentially blank cells that are everybody has them naturally in your body. Stem cells are blank cells that basically go throughout, and their job is to fix things, right? When there's problems, when there's dysfunction, they're gonna fix things, right? The signal that they get to help fix those different organs or body systems or cartilage or whatever's going on in your body, it's called a paracrine response. That's your body's 911 call saying, hey, fix me. So when that problem happens, when there's say there's a knee pain, or say it's like somebody's sagging skin from getting older, right? Like an anti-aging type deal. The area is fatigued, the stem cells aren't in a high enough concentration in the area, or your body's just really worn out, essentially, right? So when you take stem cells and you put them where the damaged area is, they replicate. What we know for a fact is they replicate into whatever cells are damaged. The way they know they're damaged, like I said, is because that paracrine response. So they will literally replicate into cartilage, bone, muscle, tissue, organ tissue, skin, hair. I mean, you name it, right? So they're basically cells that have the potential to differentiate into every cell in the body and help heal it, right?
That's actually I didn't view it at all from that perspective.
Exactly it, man. There's a lot of different kinds of stem cells.
Exactly. Let's go into that too before we move into the exosomes. You were telling me more about what is known as the stem cell, Muse stem cell, which we're seeing a lot more.
They've seen it a lot now.
Yes.
They're hot right now. They're the newest ones.
Explain that specifically if I'm saying it right. So,
Muse, yeah.
Muse. Okay. What is the
MUSE.
Muse stem cell?
Yeah. Muse stem cells are basically, all right. So when you get an umbilical cord, okay, and then they get the stem cells from the umbilical cord, those type of stem cells are called mesenchymal stem cells, okay? Of those mesenchymal stem cells, there's 1% of them is a Muse. That means they basically have full capabilities of transforming into a higher number of type of organ cells, brain cells, and they stay alive in the body much longer than a normal stem cell.
Gotcha.
Okay, so think of them like their strongest warriors. Okay, you have the strongest warriors. There's only 1% of the stem cells that you have in an umbilical cord is going to be those strong warrior. They stay alive in your body. They've had studies showing up to 2 years, but typically, up to a year.
Okay, cool.
So
that's your Muse. That's going to be probably the most, I guess, potent stem cell on the market right now.
That's going to be your most potent. Sometimes it's overkill, depending on what you're trying to work on, right?
Gotcha.
It's all about what you're working on. That's going to be more for somebody where the research is with kidney issues, liver, dementia, any type of brain condition, ALS, post-stroke, those type of patients, just kind of internal type of issues.
Very cool.
Yeah.
Let me shift gears into exosomes. Right, I'm throwing it all out. I feel like I'm putting you on a high school test. I'm like, all right,
shoot, man.
Exosomes. Walk me through like I'm a kid. Like, what's an exosome from your perspective?
All right. So you get the stem cell,
right?
And if you put it out on a petri dish, we'll say,
right,
there's these vesicles. They're really small. They're secreted by the stem cell. Those vesicles are called exosomes. Okay, they help carry messenger RNA, so signals throughout the body to help fix different things, and they're highly anti-inflammatory. One big use that they're used for is they're so small, they're 1/100th the size of a cell, so they can actually pass the blood-brain barrier in a very, very high concentration and help with neuroinflammation, any type of brain inflammation.